Welcome to our Wednesday webinar sessions. Just a few little things about how we run our process in case this is your first one. As an attendee, you don't have the ability to speak, but we have multiple options for you to be able to interact with us. There's a chat section. If you scroll around on the bottom of your screen, you'll see a little box that says chat. Please use that to talk to each other, introduce yourselves, ask for help if you have anything going on. If you have a question for the speakers, don't put it in the chat box, put that in the Q&A section. So we have a monitor for both the Q&A and the chat, and we will raise the questions at opportune times on your behalf. Our speakers have asked that we hold the questions to the end. Anyway, I'm trying to get somebody in. Hold on. We will be sharing resources and we'll send links to the video recording and certificates of attendance with about 2 to 4 weeks. We are not offering continuing education credit today, but we'll hopefully are getting ready to start doing that in the future. So pay attention to your email because you should be getting emails from us letting us know that we are getting ready. So, and we don't see any conflicts today. And just a reminder, as a disclosure, this is Academy of Forensic Nursing work, and we ask that you don't take any screenshots of the presentation. And as a reminder, the authors are bringing evidence of topics discussed, but we do know that new evidence emerges every day. It is your responsibility as a licensed professional to seek out, understand, and implement best evidence for your practice. So, Diana, I'm going to give it over to you to do the introductions.
Thank you, Angela. Well, it's my pleasure to introduce two great speakers from Ireland. The first one is MARGO Newman. She's a registered nurse since 2000 and has been working in the sexual assault treatment unit since 2012, initially as a support nurse and following a higher diploma in sexual assault forensic exams in 2015. She commenced as a full-time clinical nurse specialist in sexual assault forensics exams in 2016. During this time, she also became a nurse prescriber. I'm thinking that's probably a nurse practitioner, what we would call a nurse practitioner. She completed her MSc in Advanced Practice Nursing in SAFE in 2019 and plans to complete this in 2021, next month. Wow. Her area of research has been the impact of rape myth accompanied by adolescent males, which she plans to publish this summer. She's a member of the National SART Guidelines Committee, which developed the collaborative guidelines for the care of sexual violent victims in Ireland. She provides education to post-primary schools, etc. So I'm really happy to have her here to talk to us today. Our second speaker is AIDEEN WALSH, and I hope I'm saying your name right. She's a registered general nurse since 1996 and followed with this postgraduate training in children's nursing. So she's a RCN in 2000. During her time as shift leader in a busy pediatric emergency department, she noticed that there was a lack of specific training for nurses regarding sexual abuse. At the same time, her first higher diploma in nursing, sexual assault forensic exams, was established in the Royal College of Surgeons in Ireland. She was in the first cohort of graduates from this course and their first clinical nurse specialist in the sexual assault treatment unit. And this was in Dublin. During her time in the SATU Rotunda, she became a registered nurse prescriber, so an RNP, and completed her master's in nursing advanced practice. She has developed an understanding of the patient's experience of attending, which included a patient feedback questionnaire. And today, it is the basis of national patient feedback services for patient attending any one of the 6 sexual assault units in Ireland. All right, she's a fellow in the Faculty of Nursing and Midwifery of the Royal College of Surgeons in Ireland. So it is my great pleasure to turn this over to you ladies.
Thanks, Diane. Thanks, everyone. And good morning, good afternoon, and it's good evening in Ireland today. We've just hit 5 o'clock in the evening, so it's been a long day waiting to get started. So as Diane said, my name is Margo, and I'm one of the candidate advanced nurse practitioners in sexual assault forensic exam, working in one of 6 sexual assault treatment units in Ireland. So today I'm going to go through a whistle-stop tour of what is happening in Ireland and what has been happening. So just for an outline, we're going to talk about the Republic of Ireland, for those of you who don't know where we are, a little bit of historical perspective, because it's very important to know the history behind sexual violence in Ireland, the vision and national approach that was taken, the National START guidelines, and then I'm going to talk a little bit about the postgraduate diploma in nursing sexual assault forensic examination, which is one of the most outstanding courses there is for anyone who wants to work inside one of the sexual assault treatment units. And we're going to have a little discussion about what's next. So I understand with my accent I might be going a little bit too fast. Where I'm from in Ireland, we speak quite quickly, so I am going to try and slow it down, but if it is an issue, please do let the moderators know, and I will slow down a little bit. So here we are, Ireland. For those of you who may or may not know where we are, we're a very small little island resting on the very edge of Europe. If you leave the west of Ireland, the very next stop is New York. And if you leave New York and cross the Atlantic, the first place you'll hit is Ireland. So just to give you an idea, we're at the very edge at the top of Europe. We're next to the United Kingdom, but we're a small island, but we're a very mighty island for what we do. We have a small population, and I'm sure there's some in the audience going, oh my goodness, they're so small. We're smaller than some of your states in the United States. We have a population of 4.9 million, which actually has grown by 0.4 million over the last few years. So length and breadth, as you can see, we're not very big. In fact, you can actually drive from the very top of Ireland to the very south of Ireland in 8 hours. But we do recommend that you take your time and get to explore the country and see what's around. We're made up of 26 counties, so they'll be similar to your states, but much, much smaller. So we have 26 counties in the Republic of Ireland, and then in the north of Ireland, which is governed by the United Kingdom, there are 6 counties. So the map is just to give you an idea of where we are and where we sit in the country. So we get started on the history. So the hidden years. So Ireland gained independence back in the 1916 is really where the first, with the rising that came. And at that time, Ireland became a republic and was very much governed by the Roman Catholic Church in the state. And it was kind of a joint understanding between the two. And it was called the containment area. So it's the custom where it was the Free State, the Republic of Ireland, but there was a special relationship. And this was recognised until 1972 in the Irish Constitution. And it was the special relationship between church and state, which effectively meant that the church had a huge part to play in the running of this country. And during the mid to late 21st century, what they wanted was for Ireland to be portrayed as a country with the highest moral standing and governed by the Catholic ethos. Unfortunately, retrospectively, we've learned what a devastating impact this has had on Irish people. And even today, there are more reports coming out of the devastation that was caused by these hidden years. There was widespread abuse of women and children, and all this was covered up and accepted by the church and the state and hidden. And even to this day, trying to discover the true story of what went on in those years is proving to be quite difficult for people. And there's a lot of reports coming out at the moment talking about the practices that were. And, you know, it's when you see how far we've traveled since then, I think it's really impressive when I talk about what a mighty little country we are now. So we still have work to do, but we have done a lot of work. There was a lot of censorship and cultural norms that really went against the dignity of women and children in this country. And they wanted to portray Ireland as morally superior to other countries, which is where it became quite scary, because if you didn't follow the rules, then you were hidden away. And that's why we call it the hidden years. And you'll notice I've introduced colour in a lot of my other slides, but I really didn't want to introduce colour here because this is a stark time in Irish history. It was one of the most devastating, and the echoes of it will continue in this country for a very long time to come. But thankfully, things are progressing slowly. And although it's taken many years and there was recognition amongst different areas that something needed to happen with regard to sexual abuse and violence in Ireland, it took until 2002 for the SAVI report, it's known as in here in Ireland. So this was the first time ever it was kind of acknowledged in Ireland that there was an issue with sexual abuse and violence, but we didn't have any national numbers, statistics. It was all hearsay and retrospective stories. So we needed to find out what exactly was happening. So for this one, there was over 3,000 Irish adults contacted, and they were asked about their experience with sexual abuse and violence in their lifetime. And it really made for real stark reading, because out of those, more than 4 in 10 women, that was 42% of those questioned, and over a quarter of all the men, that's more than 28%, had experienced some sort of sexual violence in their lifetime. And as a reflection on how sexual violence was regarded in this country, sadly, 47% of those people had never ever disclosed until they were asked the question. So it was really interesting in that it gave information about perpetrators. You know, all along it was seen, you know, that rape script where it was the stranger abusing a young woman out and about. But this really gave an idea of familial abuse. And it introduced maybe for the first time the idea that we actually had female perpetrators in this country as well. And since then, there hasn't been any other study until recently, when the Minister for Justice and Equality was reflecting on the huge societal changes. And if anyone is familiar with Ireland's history, in the last few years, we have introduced abortion, it's been approved, we have gay marriage, and there's been huge strides around this area. So we still need to find out what is actually happening in this country, because there is sexual violence. Because as you see, as our service has increased, improved and developed, more and more people are coming forward to tell us their story. So the Minister commissioned a sexual violence survey in Ireland. So it's about having a look to see on the prevalence of sexual violence in Ireland, and he commissioned the Central Statistics Office to do this national survey. So it'll be all around the country, and the data will be used then to inform policy in several areas, including justice, health and education. And what's really impressive about this is that the Central Statistics Office are the ones that are developing and implementing it, but there has been massive input from this expertise around the country. So, you know, all the different people involved in the care of victims of sexual violence and sexual violence victims themselves have actually been asked to contribute to the development of this survey and how it should be implemented. So it was underway, but unfortunately COVID has had a huge impact, as we all know. So it is hoped that this will be up and running, and maybe we will have the results in the next 2 to 3 years. They're unable to give us a timeline for it being finished at the moment, which is understandable because of COVID, but it is still working away, and I'm sure it's going to give us some fantastic information. And it's really good to have a national, so it's for the whole country of Ireland. We'll know exactly what's going on, where we need to improve, where we need to work on our service, and it'll form a lot of different policy in this country. So I'm going to take a little step backwards from this present study and go back to the SAVI report. So after the SAVI report, it was decided that actually, we needed to have a look at what was happening around sexual violence in Ireland, who was being seen, who was being treated, where was it going, what was the idea. And unfortunately at that time, it was very much an ad hoc service. It really depended on who you disclosed to, where you went, local hospitals, there were little local county hospitals, and the service wasn't coordinated. We did have 4 SATUs in the country, but again, it was found that there wasn't the coordination there. So in 2006, there was a report commissioned into looking at the sexual assault treatment units that were there. And this was carried out by Angela O'Shea, a nurse. And it was a really good one because it looked at what was there and how this could be developed. So one of the 4 recommendations that came out of the O'Shea report was that we would have a dedicated response and service for victims of sexual violence, that there'd be strategically placed dedicated SATUs to be opened. So when we talk dedicated SATUs, these are units that are available 24/7, 365 days of the year for victims of sexual violence, that they would always be staffed, they're always open, they're never closed. And what we do in these units is that we see patients who experience sexual violence, and it's just for them. It's their safe space to come and be seen by experienced staff. We needed to provide a coordinated service to victims, and that's really important, the coordinated service, because there's so many different, as you know, it's a multidisciplinary, it's so complex. We needed to have a coordinated service where we were all working together to make sure that our victims received the best of quality of care, that it was a wraparound service and it was informed by the needs of victims. And also one of the recommendations was to pilot forensic nursing in Ireland. So up to this stage, it was mainly emergency nurses or GP nurses, general practitioner nurses, that were seeing these patients. And I know our old shooter used to tell us of the story that when she was in the accident and emergency, it was always the most junior staff on duty that was seeing victims of sexual violence when they presented to the ED. And herself and a colleague slowly started siphoning off all their equipment into a little side room until they met their own little dedicated unit in Donegal. And thankfully they've continued and developed the service from then, so it's great. So I'm going to talk a little bit about how this whole national review worked out for us. So the vision was to formulate a national sexual assault treatment unit service. There had to be a strategic vision, a working philosophy. We needed a mission to underpin our service, and we needed our logo, and that had to reflect everyone and everything that's involved in the service. So one of the first things was to have our dedicated and geographically placed units. So if you look, actually Dublin, number one, the Rotunda Hospital was actually the first one to be ever opened in Europe, and that was in 1984. And to this day remains one of the busiest units there is in the country. Donegal followed suit in 1998, taking care of the top of the country. And us here in Cork, we opened in 2001. And I suppose we have a very wide geographical area, a lot of rural areas that we look after. We had Waterford in 2004, and after the O'Shea report, Galway and Mullingar opened in February and August respectively in 2009. So no matter where you are in Ireland, you are only within 3 hours driving distance of a SATU. And one of our key performance indicators, our national KPIs, is that you'll be seen within 3 hours. So where the units are located very much provides for that service, that we can achieve that and provide that. So that was one of the first things to come out of the O'Shea report, is that we got our dedicated units for patients all over Ireland. No matter where you work, there was a unit there for you to look after. And what's really important is that these units worked very closely together, and there was a lot of communication and collaboration between the units. So then we needed our collaborative team. And this is really, really important. And I think this is one of the things, as somebody who works within the sexual assault treatment unit in Ireland, is something that I'm so proud of, that I'm part of this team. And as you can see at the very middle, it's, you know, we always describe it as a wheel, and wheel can't run without each other. We all are cogs in this big wheel. And it's such a fantastic working team, because everybody understands what the other person's role is in the care of a patient. So when you have a team like this, there's no sort of, well, I need to have this or you need that. I understand when a guard comes into the unit. So the police force in Ireland, I should clarify, are called An Garda Síochána. So it's Guardians of the Peace is the translation, but it would be equivalent to the police force. So when a Garda comes to the unit, I understand exactly what they're coming, what their priorities in their injured parties story is, and they understand what my patient's priority is. So it's really important. And I think in the middle, when we put patient, victim, injured party, complainant and survivor, it reflects the multidisciplinary nature of that team. And that we all have an understanding that no matter what you call the person, they are at the center of everything that we do. And we need to work together and keep this cohesive wraparound service for all our patients. So within that, you can see of your SATU team. So that's your local and your national SATU team. And that's the other thing to remember. These are national. We have a national SAR team, and we also have a local SAR team. So each SATU will have a local SAR team, and then we'll have our national SAR team, which develops a lot of our policy and our guidelines and so forth, which I'll talk about in a little while. So within this, you have your SATU team, you have your An Garda Síochána, Rape Crisis Network for psychological services, Forensic Science Ireland for our DNA, general practitioners who are referred to our patients afterwards. TUSLA is the Child and Family Agency here in Ireland, so children who may be endangered. TUSLA are very much involved with our patients as well. Our non-governmental organisations, whether these are the charitable homeless services or wherever we need to refer them, and of course the infectious diseases team play a huge part. So communication and collaboration between this team is really important. It's and it's great. It's really good to understand where everyone's come from. So, you know, we can work together very cohesively. We're all involved in developing policy guidelines together and education programs. So the vision, we all needed to work effectively together, and I'm very proud to say that that does work very well. We needed to give an optimum response, and to give an optimum response, we need to work very effectively together, and we do that by understanding each other's role. We needed person options. It couldn't be the service provider options. It had to be the person options, and they had to be supported in the decisions that they made. We also have a role to play in preventing and reducing sexual violence, and continuous quality improvement is a huge part of the work that we do within the national SATUS. We're constantly striving to improve our service. We do a lot of education and professional development, either ourselves as units, as forensic examiners, but also for the larger population. We do a lot of education and development with them. And we have accountability. We have accountability to our victims, to our colleagues, to our society, and to the national SATU team, which is really important for us. So our philosophy, and this really underpins, and every member of that SAR team, this is their working philosophy. So it's a multi-agency team, and we believe that by understanding and appreciating the particular dynamics and sensitivities involved, we provide individualized, timely, person-centered services. And I think that's really seen with our KPI, that everybody is seen within 3 hours of a request for a service. And following on from our philosophy, we had our mission statement. And is to provide a range of specialist multi-agency responses following rape or sexual assault, and they're delivered in a respectful, non-judgmental and a supportive manner by skilled, competent professionals. And we maintain our competence by sharing all the time our information, our knowledge, you know, supporting each other, developing those skills. And that's really important, that we can see the bigger picture. It's not just the forensic examiner, it's also the member of law enforcement, it's for Forensic Science Ireland, it's ID, and that's how we can do that, by working very cohesively together. And our SATU, you'll notice, bar the one slide for the hidden years, these colours come throughout all my presentation. So this is our logo, it's the Irish SATU logo, and it's something, again, we're very proud people here, we're very proud of this. So this was designed and developed and donated to us by Andrea Mars, a graphic designer in Galway, and it conveys the essence and the values of the Irish SATUs. So it's got a firm base to support practice. It's got 2 hands to form a shelter. The blue is representing of law enforcement and the green is representative of the healthcare system. And it echoes the values of the organisations involved. And I think this is something that has really brought us together. Everything that you see with SATU, these are the colours that we use, because it very much represents, and it shows the values that we have. It's the values of our organisation. It's caring, trustworthiness, impartiality, partnership and professionalism. So that logo is the SATU logo, and it'll be on everything that we do. That logo will follow. So for this vision of a dedicated service, what did we need to do first? It took a lot of work. There was a lot of input, a lot of discussion, a lot of collaboration between the providers of sexual violence services, between the ED departments, and again, those members of the SAR team that I discussed afterwards. So we needed to have a focus, a twofold focus. So we needed to meet the person's healthcare needs, but we also needed to meet the needs of the criminal justice system. And that was important, that both received equal care, that we looked at both of them and found a way to marry the two together. So through this was the development of the National SATU Guidelines. So these are guidelines, the SAR team that we discussed earlier, we developed guidelines for anyone who is involved in the care of a victim of sexual violence. It's a readily available and comprehensive interagency document, and it aims to ensure that our patients receive similarly responsive and holistic forensic, medical and on-site psychological and follow-up care, no matter which unit they attend. So wherever you go in Ireland, whichever unit you attend, whichever member of the SAR team you meet, they will all be working from the same document. And that has worked really, really well, because it gives, again, an understanding of the priorities for different organisations, and where the patient lies is always, always in the middle of everything that we do. So these are our guidelines, and we update them on a 4-year cycle. And if you actually look, they're colour coordinated, very easy to use, very easy to follow. And if you look at them, it actually follows through the journey of the patient. So the first person they will normally disclose to is a member of law enforcement. and then they're brought to the SATU, and then they meet the psychological support services, and then they have their STI screening. They may have Forensic Science Ireland, then onto their GP, and then onto the legal part of their journey. So it's really, you know, it's so easy to use, it's user friendly. Everybody from these different organizations will work off them. The 4th edition came out in 2018, and it was the first time that we actually had child and adolescent forensic medical assessment guidelines in Ireland. We hadn't had those before. So it really it's a huge piece of work. I know we're getting ready to start the 5th edition, and already the emails are going out asking us, you know, and it's good to keep them up to date. They have to reflect the changes, not only in healthcare, but also in legal, and that we update our guidelines consistently to reflect those changes and to reflect the work that's been done, and so that we can capture and make sure that our patients are getting the most up to date and best of care. And the fact that it's collaborative guidelines makes it that much stronger, that, you know, we all refer to each other with regards to the guidelines. If somebody's not sure, when I teach in the Garda Training College, I will always refer them to the national guidelines, because it's exactly, they're laid out, and this has been brought together with their own profession. So members of An Garda Síochána have worked to put these into the guidelines. So it has that understanding. It'll use the information and the language that they're used to using, and, you know, it brings it all together for somebody. So you're not going to have a different document for every member of the team. So for that, it has been very, very successful. And I must say, I do refer to it as the Bible of care for patients in Ireland. It's really, really impressive. I've put a link on the end of it if anybody wants to link on to have a look at them, to download it and see the way that we work. It also has a template for legal report from when we're finished our cases, that we develop our legal report to send on to the Director of Public Prosecutions for those cases. So along with this national review, there was also O'Shea in 2006 wanted the introduction of a pilot programme in forensic nursing in Ireland, where nurses would undergo a higher diploma in order to qualify as clinical nurse specialists in Ireland. So that has been running, as you heard during the bios, that AIDEEN was at the first cohort of this. So it's realising the vision for forensic nurse examiners. So there was a higher diploma in nursing and sexual assault forensic examination, and that ran in there was 3 cohorts from 2009 until 2016. And then that was upgraded in 2018 to a level 9 postgraduate diploma in nursing and sexual assault forensic examination. And we have just recently, in the last 2 years, there has been a master's in advanced nurse practitioner in sexual assault forensic examination. So the role of the forensic examiner, it's developing all the time, and it's recognizing the input they have in the service, the uniqueness of the role in nursing. And it's a very new role in Ireland. It's only been here, you know, 10 or 11 years. So there's been a lot of work around developing this role, and we're very proud of it, I have to add. So what it is, so it's actually a 12 months practical and theoretical. So you actually are sponsored from the SATU service, the hospital that your SATU is based in, and you are seconded for 12 months for practical and theoretical modules. It runs in collaboration with the Health Service Executive in Ireland, the Rotunda Hospital Dublin, the Royal College of Surgeons, and all the other SATUs. So you have different placements during those 12 months, and it is a very tough 12 months. It's full on. It's going into areas that maybe you never would have gone before, that you wouldn't know as a nurse, and it's introducing us to all the different areas of the teams that are involved in the care. So you could, you know, do placement with An Garda Síochána, the Rape Crisis Centres, Forensic Science Ireland, genital urinary medicine. You go to emergency rooms for placement, into the gynae services, infectious diseases. You do a module with the Director of Public Prosecution. You do colposcopy, spend time with the Central Criminal Courts, and then you do rotations, 24/7 rotations in the sexual assault treatment unit. So you could be in Dublin for a week, you could be in Cork for a week, you could be in different areas. So it's developing, and what is good about this is that it allows you to develop pathways with your local services. You get to understand what's out there and the different referral places that you can send your patient later on. And it helps build relationships between the sexual assault response team. Again, it's increasing that understanding of each other's role in the care of patients who experience sexual violence. So it's intense, but it's definitely, it's an amazing course to get a part of. There has only been 30 places since 2009, which I think reflects, you know, how intense and is quite a difficult one to run, I'm sure, because there's a lot of different placements, a lot of different areas buying into it, but it has been very successful so far. And the modules that you undertake, so you undertake, it has been in conjunction with the Royal College of Surgeons in Ireland. So you do your legal and ethical issues, you do a research module, you do a leadership module, you do your principles of forensic sexual assault nursing, you do law in relation to forensic nursing and courtroom skills, and holistic care of victims of sexual assault. And these are all exam modules. You either have to complete an exam and pass it, or you need to do a bit of academic literature with regards to the different modules. And that's run over the 12 months. So that it's quite a commitment to take on when you do go into this course. But again, it gives you all the skills that you need to progress the role. And really, this is what we're here for, clinical. So we're here, we need to know how to take care of the clinical part of looking after patients, to provide those examinations, to do the follow-up medical care that they need. We need to be advocates for our patient, and that's very important. We are the voice a lot of time. And as the forensic nurse role has grown in Ireland, we've become more and more of an advocate for our patients. And along with our colleagues throughout the SATUS and the SARTs, we're very, very much becoming a very loud advocate for victims of sexual violence in Ireland. We provide consultancy. We're always available if anyone is not sure, if they don't know where to go, if they don't know what to do. We're here for that. We're here to provide training and education. We go into primary schools, we go into secondary schools, we go into universities, other healthcare providers. It's really important that they learn what we're about and how we provide our care. Excuse me. We also do audit, which is really important to ensure that we are getting the highest quality of care there for our patients. And we're involved in research, and research will help us develop the service that we want to provide for our patients. So just about the advanced nurse practitioner. Advanced nurse practitioner in Ireland has been quite slow to take off and has been quite a difficult pathway. But we were very proud to have our first registered advanced nurse practitioner, Miss Debbie Marshall, in 2017. And then we had AIDEEN, who became the first RMP in child sex abuse. And the Department of Health review that I'm going to talk about in a little while did suggest that there's a minimum of 1 registered advanced nurse practitioner in each unit and 2 CNSs for every unit. So you would have those staff there full time. And currently we have 2 registered advanced nurse, we have 3 actually registered advanced nurse practitioners and 2 candidate AMPs, and hopefully that journey will be ending for me quite shortly and we will become a registered advanced nurse practitioner. So it's great to see how the service has progressed since, you know, the introduction of a pilot forensic nursing course in 2006 to now at 2021, where we're going to have nearly 5 registered advanced nurse practitioners in sexual assault forensic examination. So the services that we provide, I'm sorry now, I feel like I'm going very fast, but there's a lot to cover. So what we do, we're a service, as I said, that's open 24/7, 365. There's always a case of a team on call. So with your local sexual assault response team, you'll either have a forensic medical examiner or a forensic nurse examiner. We all work off the same sheet. You'll have a support nurse and you'll have somebody from a crisis. So we provide forensic examination. So again, this is within 7 days of the assault, the sooner the better. We do a full sexual offences examination kit, examine for injuries, referrals if need be, and organise any medications that might be needed for the person. We also provide health checks. So this is somebody who maybe does not want to report at that moment in time, or has this, you know, it's outside the 7-day time frame, but we will see them to provide them with the medication, STI screening, linking them into counselling services as needed. And in 2017, we introduced collection and storage of forensic evidence. So this is where we had patients that were coming that really couldn't decide if they wanted to report on Garda Síochána, and were slow to report it. So now we can collect their evidence and we'll actually store it here in the unit, and we keep it for up to a year, and in some cases 2 years, and it just gives our patients that little bit of breathing space that they can decide if they want to go forward, and if they want to report it, then their samples are kept here. So when that started initially in 2017, I think we all expected it to be, you know, slow on the uptake, but actually it has become one of the busiest options that people will take is an option 3, and it's great because it gives them a little bit of time to get back in control and to get their head around what has been a horrendous experience. So we provide emergency contraception, we give STI prophylaxis and HIV PEP, we organise for STI screening in the unit, we give access to psychological support services. And what's amazing is that every service that we provide and every medication that we provide are universally free of charge. There is absolutely no charge for anything if you've been a victim of sexual violence in Ireland. It doesn't matter if you're not a resident in Ireland, if you're here on holidays, if you're travelling, it does not matter. You will get your service free of charge. And this has been really important with the high level of, of movement of people into the country that maybe aren't registered here in this country yet, that the healthcare is there for them free of charge. We don't look for their social security numbers or anything like that. We just want to make sure that they're taken care of and they're linked in with the best service. And we also travel. So if a patient, is medically unable to come to the unit, these units are purpose developed. We some are based in hospitals, one is based in a maternity hospital, some are based near an emergency room, and some are based out away from a hospital. So that's the important thing. We can travel to the patient. We have a grab-go bag where we can go to wherever we're needed. If it's a nursing home, if it's a prison, if it's an emergency room or an acute psychiatric ward, we're willing to travel as well. And I think, that really is working around providing the best care that we possibly can to our patients. And not only that, but then with regards follow-up, all the follow-up care is seen in the sexual assault treatment units. So once you attend initially, you are invited back after a month, and we do contact through either texting or ringing, and we keep in contact a lot of the time just to see how people are getting on. And it's the CNSs and AMP that do the follow-up care. So they will see all the patients who attended, and there's a huge uptake in this. So after a month, we offered an STI screen, we offer a second dose Hep B vaccine, and we just check to see how they're getting on. How are they coping with things? Have they linked in with psychological supports? Is there maybe another referral pathway we need for them or something to discuss? And often this is the time where they'll come back and things that maybe hadn't come up initially, they'll start to tell you about, and you can see what support network there's there for them. A lot of the time they won't remember a lot of what happened, so you can go back over what actually happened when they did attend the first time. We invite them back again 3 months for repeat HIV, Hep B and C and syphilis serology, and then again at 6 months for a third dose Hep B vaccine. And then they get their immunity check at 8 months. Anyone under the age of 18, we do a referral to TUSLA, the social work referral, just to make sure that the support services are there for them if needs be. And the thing about this, again, it's all free and it can be done to suit the patient. We do follow-up clinics. We don't do them to order, we do to suit the patient. So if it takes them 4 or 5 attempts before they can actually walk through the door, then that's okay. We'll accommodate that. We'll talk them through it, and we'll accommodate whatever they need to help them on their way to recovery. Unfortunately, you will have your patients that will need to come back a few times, those maybe who are living in a violent situation where they're consistently exposed, that they need to have repeated exams and that, and we'll do that. We'll support them for as long as they need to be supported. But generally it's a year. After a year, people tend to be quite happy to discharge themselves from the service. And we do a lot of referrals. So even though we're a small country, we travel quite a bit around the country. So if it's, and we have a high student population. So if somebody is assaulted in Cork, but maybe their residence is in Dublin, then I can, I can refer them to that SATU for a follow-up. So even though they may have had their initial assessment here with me, in a month's time they'll have an appointment to attend the Dublin unit, and that's really good because it's flexible for patients. It suits them. It just takes that whole fear of how they're going to get back to you, and missing out on follow-up. So having that ease of referral between the units is really important for patients to suit their needs. So I'm nearly there, I promise. I've been broken lots of years. So while I said we had a horrible history that we're still kind of working on, we need to look at the impact of sexual assault treatment units and sexual violence in Ireland since 2006. And actually, I could have put about 50 slides, but my colleague and I had to look at these and said, I better stop showing off all the things that we've achieved for such a small organisation. You know, we have a national director, Dr. Maeve Ogan, who's leading us out in this. You know, she coordinates the service for us, and it's kind of, there's so much communication and teamwork between. I think that's really important to acknowledge, the teamwork within the SATUs and the support. So we've moved from having an often ad hoc, uncoordinated service to where we now have such a comprehensive, cohesive and collaborative service that recognises the medical and the legal and psychological complexities of sexual violence survivors. So I've put a little, you know, a few little things here. So since 2009, we've seen more than 8,000 patients. And while for some areas that might be huge, when you know the history of Ireland, that's really, really good to see that people are coming forward. And even during COVID times, we stayed open the whole way through COVID. There was, you know, there was no way we were closing our doors. We knew that it was a time that we would be really, and we've had 3 lockdowns in Ireland, so we're only now slowly coming out of our 3rd one. We've been in lockdown since just after Christmas Day, so it's only now the country is starting to open up again, but we've stayed open for service the whole way through, and I think that's testament to the dedication of the staff working within the units. And we only had a 20% drop in patients during 2020 compared to 2019, which is really good. We now have registered advanced nurse practitioners who've been through comprehensive, intensive training around the area of sexual assault forensic education, and not just in the collection of forensic specimen, but also in the follow-up care. So the long-term care of these patients, giving them, you know, the positive start in their journey to recovery and being beside them to support them for that. There's a 2-day forensic program run by Dr. Andrea Holmes, and this is a medics introductory training course. So doctors who want to come and work in the SATUs, they can attend this 2-day program around sexual assault forensic examination, and that's really good to actually have specialised. So you have doctors coming into on call that know exactly what we're doing. The sexual violence prevention education programs for schools, statutory and non-statutory. My love will always be for the schools. And I know my colleagues are the same. We do a huge amount of work with teenagers around sexual violence myths and rape script, and, you know, how to deal with sexual assault and violence and how to try and stop it and prevent it. So it's been really interesting. We collaborate with the higher educational institutions. We have a database that initially started off, it was a national database between the 6 units, but has progressed through, you know, our registered advanced nurse practitioner, Donegal Connie, who has developed a web-based national database, which allows us to collate all the information we have on victims who attend the units. AIDEEN's national patient feedback form, which has been fantastic as well. You know, we've standardized documentation. We all use the same documentation. We have the first purpose-built, while all our units are purpose-developed, we had the first purpose-built SATU opened in Donegal in 2019. And that's really important, I think. You know, and all this hard work that's been done between the forensic nurse examiners, the forensic medical examiners, and the different members of the SATU teams. This was really reflected in 2019 when the Minister for Health did a review of the sexual assault treatment units. And this was a really big review because they wanted to see how had things progressed since 2006. And, you know, it resulted in a very big input into our units. So there's a 1-year, a 3-year, and a 10-year plan, and there is a commitment to, you know, and making sure that these plans are played out in full. Our clinical directors, we now have protected 0.25 whole-time equivalent for the clinical directors, which has been fantastic. It means that, you know, while they were committed, a lot of them weren't paid, and it was very difficult trying to fit in around, but now they have protected time. There's investment in training of forensic medical examiners and nurse examiners, and the development of the CNS and the A&P. Clerical support. Some of us had no clerical support, so we became very adept at typing up reports and doing all that. So we now have clerical support. There's a very clear governance structure now with budgets and with appointments of a national clinical director who oversees all that. And we got a wish list. We were all told to make a wish list for our unit renovations, which was fantastic, which meant that we were able to, you know, using the patient feedback, develop our units to reflect what the patient said they needed. Not that what we thought they needed, but what our service users were able to tell us that we wanted. And as I said, our first purpose-built SATU in Donegal. So how do we look? We are working we are striving forward. We've recently set up ANAM-SAFE, which is the Association of Irish Nurses and Midwives in Sexual Assault Forensic Examination. It's a brand new association here in Ireland, and it's been formed by the nurses who work in the units because we understand the amount of knowledge that's there, you know, and information that we can use to develop the service. We work collaboratively with all our medical colleagues, you know, in this service and developing service for our patients. We do national annual study days for the whole country where we invite everyone to come and, you know, share the information, let us know what's happening, and we let people know what's happening in our country. And we're slowly reaching out. As time is going on, we're becoming much, much stronger and giving more, having more of an impact, and we're determined to have a bigger voice and let people see the way the work has progressed in a very, very short amount of time, really, when you look at where it was to what we now have, this amazing service that's dedicated 24-hour wraparound service, you know, and I think it's something, particularly the collaborative piece, that we need to share that information internationally to see how it can work and how it does work and give guidelines around it. So on that note, I'm going to finish because I know Aideen is waiting. I just want to say Gurv Mila Mahabat, thank you. And I've included my my email address if anybody would like to contact, and the website to get all the, we have different documentation for SATU, we have different videos that you can link onto to see what happens in the unit, and these are all patient friendly, so they can link on if they're not sure what happens in the unit, so they'll understand. And I think this is the most important slide of the day. Níl cearco cure le céile. There's no strength without unity. And I think the development of the sexual assault treatment units in Ireland definitely shows that there's no strength without unity. Thank you very much for listening. I appreciate it. Thank you. And I'm going to stop.
Thank you. And if we can go ahead and Aideen, have you share your screen.
Okay.
And we've had a little bit of a lag. You've noticed that on your end, Margo, but we didn't lose you at any time, so that's good.
Okay, good.
So Margo, Aideen, whenever you're ready.
Okay, thank you. You can hear me, I'm sure. Okay, so thank you so much, Margo. That's fantastic, and it's a hard show to follow, but it brought back a lot of memories for me of walking the path in forensic nursing, and very proud to be part of it along the way. And it's certainly, there's a great bunch of nurses that we're not big in numbers, but we're strong in voice. So that really helps to get our work to where it is today. So Margo has talked about the adult services, and I now work in the child sexual abuse service. I'm a registered general nurse and children's nurse and a registered advanced nurse practitioner. I did my SATU exams with the IAFN in 2019, so I'm also a registered SATU. And that's where I am with developing my career to help develop the services for child sexual abuse here in Ireland. So I'm going to hopefully go through my slides that aren't moving forward for me as I'm speaking. And there we go. Okay, so just to acknowledge the information given in Margo's presentation, as I say, that was fantastic. And we'll have a little look at the child sexual abuse medical services in Ireland, just a short history, and where children's nursing is in general, what the interagency response is, and what our future is. So similar to the sexual violence history in Ireland, what developed and what the services developed in the 80s and 90s, similar to the adult service, it was dependent on location and the individual professionals involved. There were some sexual assault treatment units, as Margo outlined, in Dublin and Donegal and Waterford and Cork. But alongside that, they looked after adolescents and adults for younger children and pre-pubertal or pubertal children, and the service was less cohesive. So there were some pediatric surgeons in some of the pediatric hospitals, and there are 3 pediatric hospitals in Dublin, and then pediatric units in the regional hospitals around the country. So some paediatric services, surgeons who would have worked in other areas, sometimes in other countries, and had experience in examining children who had presented with child sexual abuse, may have had an interest in looking after these children, so provided a service there. Similarly, in paediatric emergency departments, dependent on the individual involved, obstetric and gynae consultants with special interest in paediatrics also offered these services, but it was very ad hoc, and while their work was very good, and they were very specialised in their care, they didn't have that other structured support team to support them through that. And you can see from Margo's presentation there the importance of the structured team to have a good cohesive response to sexual violence, and especially in child sexual abuse. There were pediatricians in other parts of the country who had a special interest in child protection who did these examinations, and I suppose their expertise grew, and the expertise for the less specialist pediatricians lessened, which meant that there was a driving force to develop the services in specialised areas. And along with the work in the 6 sexual assault treatment units, and when up to 2009, then there were 6 units nationally, and alongside the service in Galway, there was the first paediatric forensic medical service. It's known as the CASATS, the Child and Adolescent Sexual Assault Treatment Service, and that's the only 24/7 forensic medical service in Ireland to date. It has launched the pilot site for the Barnahouse model of care. That was in September 2019. I'll talk a little bit about that in a little while. Another landmark was in 2017, I started back in Crumlin in the Paediatric in Children's Hospital Ireland to coordinate the forensic medical service. So at the time in 2017, there were some paediatricians providing an on-call or on-request service to the other support services, so the assessment and therapy, the psychological support services for the child sexual abuse unit there. But there was no structured whole-time people working in that. So I was the first person to do that in 2017, and my colleague Sue has joined me full-time back here since 2019, and that's made a huge difference to the service that we provide. We still have 3 paediatricians who provide a sectional basis their cover for the service, which is really valuable, but the whole time working in the service is how the service develops and becomes more structured. And the 2018 edition of the National Guidelines on Referral and Forensic Clinical Examination, this was the 4th edition in 2018, and this is when we launched the Child and Adolescent Forensic Medical Assessment Guidelines to this really valuable document. In the document, it looked at what the qualifications for nurses carrying out the child sexual abuse examinations, and I think this was a real game changer from a career development and a service development, and guided nurses in developing their careers in the specialist area, because obviously developing into the specialist area removes you from the more generalist role and narrows your scope of employability in some people's eyes. However, developing that expertise is really, really valuable for both the patients and for the nurses themselves. So in the edition of the guidelines, it highlighted that the nurse needs to be a registered nurse and have at least 5 years post-registration experience, and then 2 years in the relevant area of clinical practice, and then to obtain the postgraduate qualification, as Margo has outlined as well. In children under 14 years of age, and 14 is the cut-off age group for attending the adult versus child and adolescent service, and that was to put a number for the other professionals involved in responding to a disclosure of child sexual abuse. I mean, generally it's around pre-pubertal, post-pubertal, but that can be difficult for non-medical people to identify that. So it was determined that it would be 14 years as the age for acute forensic examinations to be carried out in the adult services, and under 14 they are referred to the child and adolescent forensic service. So to carry out the forensic examinations for an under 14-year-old, the nurse also had to have a paediatric qualification in child sexual abuse, similar to the same P course in the IAFN. And just to give you some background around nursing in Ireland, the Nursing and Midwifery Board is the regulatory body for nurses, and the regulation of nursing is to protect patients and the public. So there are standards to meet for registration, and the initial registrations have different divisions. So you can register as a registered general nurse or registered midwife, registered children's nurse, registered psychiatric nurse, and registered nurse in intellectual disability. And then with additional post-registration qualifications, you can add other divisions to your qualifications. So some people will be a registered general nurse and a midwife, or a registered general nurse and a children's nurse, etc. But you can also be a nurse tutor or a public health nurse, nurse prescriber, or also, as Margo has outlined, a registered advanced nurse practitioner. So other post-registration qualifications can be undertaken in many specialist areas, including the higher diploma or the postgraduate diploma in nursing, but that alone doesn't qualify you to register in the additional divisions. There are you need clinical practice, etc., to register as an advanced nurse practitioner. So here's a lovely green map of Ireland again, similar to Margo's one. So there are 6 sexual assault treatment services for adults, but 3 child sexual abuse services in Ireland. And they're based in Dublin, in the Laurels Clinic, which is Children's Health Ireland at Crumlin. And then Galway is in the CASAT service, and that's part of the SATU service there as well, which is a co-load patient service for all age groups, which is really effective, and that enables a 24-hour availability, and it has introduced the Barna House model of care. In Cork, the medical examinations for children are carried out in the Family Centre. Again, similar to Dublin, it's a Monday to Friday centre, and we hope to develop both of those to a more accessible opening hours in short-term future. From a nursing perspective, we have clinical nurse specialists working in the units, and progressing then to registered advanced nurse practitioners. There are consultant paediatricians who I've mentioned who work on a sessional basis in those units as well. And I've talked about the 14 to 18 year age group, attending the adult services. So from a Laurel's perspective, the unit I work in here in Children's Health Ireland at Crumlin, and we provide forensic and child protection medical assessments for children and young people where there's a concern or a disclosure about child sexual abuse. And I suppose that's one of the differences in child sexual abuse, that we often don't know if there has been an actual abusive episode, but there's been concern from parents or other adults in their lives. So the medical examination, while it may not be of evidential benefit if it's outside of a forensic time frame, it can be a reassuring and a therapeutic examination for children who where that concern around child sexual abuse is. Another big difference in the forensic time frame for pre-pubertal females is 72 hours. So that's quite a short time frame. If there's a delay in the disclosure, and if there's limited accessibility in services, that can be quite challenging. So there is pressure to extend the services. I put in these slides here to have a look at the impact of nursing. I think it's quite clear in that when there was a full-time nursing input into the services, the numbers of attendances have increased dramatically. And you know, the old saying of build it and it will grow, that certainly happened in the Laurels Clinic. In 2014, there were 2 part-time consultants where there were only 3 clinics per month available for child sexual abuse. So forensics really didn't come into it, or more historic cases or medical examinations around child protection, where, you know, has happened recently, or there was in the past, there may have been a delay in seeing them, so that it wasn't ideal. So in 2020, we saw 158 patients, we had 158 attendances, sorry, so 98 of those were new patients, and that was similar to the year before, even with the COVID pandemic and the 3 lockdown episodes, etc. Our attendances were similar to the previous year. Our return appointments have increased hugely as well, and again, a lot of those are nurse-led clinics where we do STI screening, we do vaccinations, so the nursing input into the development of these clinics is really evident. This is just to highlight the differences, and I think it's quite good to understand the differences between adult and children's services, because it has an impact on service provision. So when in the children's services we take a history from a child, we don't take it directly from the child, because the acquiring best evidences interview is carried out by specialist interviewers who are specially trained TUSLA social workers or members of An Garda Síochána, so that those interviews can then be used as evidence in court. So we take our history from the parent or from the professional who has referred them in. So sometimes that's a social worker, sometimes it's a guard, but generally it's the safe adult in their life. Whereas in the adult services, it's taken directly from the patient. A lot of adult disclosures are acute, whereas the majority of child and adolescent disclosures are delayed, which means that there aren't generally forensic evidence opportunities in delayed disclosures, and that's usually because the child has been, groomed, or they don't feel safe to tell that they have been sexually assaulted, and they may have been threatened or warned that if they tell their secret to anybody else, there'll be more harm for them. In SATU, we have written diagrams and written notes and written diagrams. In child and adolescent services, we use colposcopy to photo document any genital examination and any injuries they may have, and that's standard practice in child and adolescent service. And again, in adult services, the top-to-toe examination includes an internal examination, whereas in the child and adolescent service, for prepubertal females, it's an external anogenital examination. This slide just reflects the interagency response to child sexual abuse. Very, very important, and it's the model of care that we use in all the units providing response to child sexual abuse. So from a forensic medical point of view, and the child protection assessments, we do that in a health service. Then the child protection mandated response to child protection is by TUSLA, the Child and Family Agency. They also do the specialist interviews. They substantiate or ground the concern to look at the credibility of the disclosure and the accusation against somebody around the child sexual abuse. A lot of that is done by TUSLA. The criminal justice system is involves An Garda Síochána. They offer a first response, obviously, in an acute disclosure of child sexual abuse, but they have a specialist response unit called protective services units, where they have specialist interviewers who are trained in interviewing children for acquiring best evidence that can then be used in the court. We also, in Children's Health Ireland at Crumlin, we have an assessment and therapy service, and this is a unit that is staffed by social workers, psychologists, psychotherapists, family therapists, play therapists, who all work with children and families where there's a grounded concern of child sexual abuse. These units are specific to Dublin. Outside of the Dublin area, these resources are through TUSLA, Child and Family Agency, and HSE, or other non-government organisations and private counselling therapy providers. The Children First Act in 2015, which was enacted in 2017, introduced mandatory reporting. So this meant that persons who have contact with children and or families because of their qualifications, training and or employment are in a key position to protect children from harm, and they are mandated to report any concerns of harm to a child to TUSLA, Child and Family Agency. So we link in with all the children who attend the Laurels Clinic will be referred to TUSLA, and the TUSLA social worker will then engage with the family to offer support, to ensure that obviously that the child is safe and free from danger, but also offer support services either through TUSLA themselves or to other specialist services depending on the child's need. I've mentioned the Barna House model of care, and some of you may be aware of this already. It's similar to the child advocacy centres in the US, but it's Barna House is the Scandinavian word for children's house. So the model of care works as a child-friendly office under one roof where law enforcement, child protection, medical and therapeutic workers cooperate and assess together the situation of the child and decide upon the follow-up. So it's very child-focused, where the child is at the centre and the professionals come to the child. It's an governmental interdepartmental service, so there's lots of guidance and legislation and policy development from an interdepartmental perspective. The child and family are centred to it all, but the Department of Health offer forensic and medical examinations, as I've described already, similar to what we do here in the Laurels Clinic. And they also offer assessment and therapy services, but sometimes the Department of Children, Equity, Disability, Integration and Youth, which is the leading department for TUSLA, Child and Family Agency, they also offer assessment and therapy services. TUSLA may also be involved in forensic interviewing, as well as specialist Gardaí who can be involved in that as well. So all the agencies work together to provide that holistic approach and work together as professionals to ensure the best care for that child, and then the child comes to that central service where the service can be provided. So the pilot launch of that has happened in Galway, and we're starting the work here in Dublin, and hoping that it will be something that we will be working in the next year or two. And this is supported by the EU Promise project, which sets the standards for each aspect of care, including health, therapy, justice, child protection, etc. So there are 10 standards of care clearly outlined in that. So these are the sites again for the Barnahouse East, the Barnahouse West and the South. As I say, the launch of the Barnahouse at Galway happened in September 2019, and we're working on it in Dublin, and the work is started in Cork as well. So I suppose just to say that children are not little adults. They're very different. They have their own unique needs. And as children's nurses, we realise and appreciate that. They have different and unique exposures in all aspects of life. So they have different vulnerabilities, different opportunities, different understanding. They have a dynamic developmental physiology. So we need to appreciate that. And, you know, I suppose that leads to why the difference in qualifications and training and skill set is required for looking after children. They have a longer life expectancy, obviously, than us adults. And they are politically powerless. So we need to be their voice. We need to be their advocates, and to ensure that everything is done correctly for them. So children's nurses are in an ideal position to embrace and influence this approach to child-centred care. So that's a wrap up of my conversation, and happy to take questions. I suppose just to finish off, to say that the future is bright. Children are not small adults, and we recognise that the specialist roles are key to the success, and hopefully that's what we provide here in the Laurels Clinic. So thank you for listening. I'm going to stop sharing, and
there's a couple questions.
Great.
Okay.
They want to know if the records are protected from the general health record.
Yeah.
I didn't hear that, but yeah.
Will I go with that one, Aideen?
Yeah.
So yeah, our records are independent of the hospitals within where we work. So they are allocated a specific SATU number. That is the number. Everything is done through numbers. We don't use names, we use initials and dates of birth. And those records really are kept within the units and stored here in the units. Our national database is not part of the generalized inpatient record system. So we have a database that's only accessible by special, you have to be an approved administrator to access those records. So the written records are kept within the units. The only people that have access are the people in the units. So it would be the advanced nurse practitioners, the CNSs and the forensic medical examiners, and everything is kept there. And again, same with the databases. So it is very separate. If you attend a hospital, it does not come up on your record that you've attended a sexual assault treatment unit. That's your information to share as you see fit.
Great. Deb Robinson has a question. She wants to know if there's any trafficking issues in Ireland.
Yes. Do you want to go with that, Aideen, or will I go first?
There are for both children and adults, and we have specialist units in our Garda sections. But in the SATUS, certainly it's an ideal opportunity to identify victims of human trafficking. And I suppose, you know, we've some of us have done some additional training in that, and linking in with the local services where victims can engage with support services once they've been to a SATU, and that's one of the advantages of having the specialist role of, you know, having core staff working in a SATU, where we can build those links with local services and have an understanding and build up a good working relationship on where we can direct people to access services.
Great, we've got another question. Do incarcerated persons receive your services?
Yeah, so as Margo had, sorry, I'm jumping in there again,
No,
Margo.
Margo
had described the grab and go bag earlier. So back in about 2010, maybe 2011, we developed good working relationships with the prison services, and have developed policies around the SATU team going to the prisons to provide the forensic medical services there. Often it's safer for us to travel to a prison rather than for prisoners to come to us. It's usually people who have been recently admitted to prison, disclose that something has happened just prior to being incarcerated, or it can happen, you know, when they have been in prison as well. It does involve the Gardaí, who are external to the prison, investigating, etc. So yeah, I feel we have a good system that we can go to the prisons if that's safer for the prisoner.
And then a last question here from Dr. Speck. Talk about how your programs fit into the overarching health system. I think you answered a little of that, but if you could just summarize it, please.
So I suppose with the review in 2019, that's really where we came into our own, where we fit into. Up until then, it was very kind of hit and miss where we fell under. But with the review, we were allocated, you know, our dedicated service falls under the Women and Children's Health Service. We have our National Clinical Director, so we're very much a protected service within the health service here in Ireland, and very much recognised as a specialist protected service, and have great working relationships with all the different areas that are there. So since the review by the Minister for Health and the Department of Health, that's where we fit into the health system now. We're a very protected service within the health service.